Sure.
When you introduce her, that'd be great.
Okay, awesome.
All
No
right,
problem.
Stand by. We're recording in 5, 4, 3.
Welcome back to Healthy Living. Now we're here with Missy Moore. She is our Director of Cardiopulmonary Services in our sleep lab. And we're going to continue our theme kind of talking about lung health. So welcome, Missy. Thanks for being here today.
Thank you.
Let's talk about what you do. What do you do for St. Tammany Health System? And tell people a little bit about yourself.
I have lived here in St. Tammany since 1978, so I've been here a long time. I worked at St. Tammany for 26 years. I oversee the cardiac and pulmonary rehab program at the outpatient pavilion, and I'm also over the sleep lab. So
Okay.
been doing that for a little while now.
So tell people where the outpatient pavilion is and the sleep lab, because I'm not sure if most folks know that.
The cardiac and pulmonary rehab is at the outpatient pavilion, which is right off of Bootlegger Road,
Okay.
where the new ambulatory surgery center is being built. And sleep lab is over near Flowers Estates by 80 Gardenia Drive.
Okay. So as you know, November is Lung Cancer Awareness Month, and we are going to recognize that month with the St. Tammany United and Pearl Recognition Month and the 2023 Power of Pearls Lung Cancer Walk. And we want to talk about lung health in general. Before we talk about any kind of pulmonary treatment, anything like that, let's talk about what we can do to keep our lungs healthy, because I know you know, and you probably drill it home to your patients. So
The first thing is maintain a smoke-free life. If you currently smoke, quit smoking. If you don't smoke, continue to not smoke. That is the first thing. Exercise is very important, even if it's just a mild, like 30 minutes, 20 minutes, if that's all you can do, that helps with your lung health. Doing your regular checkups with your physician, that is also, something that helps, because a physician can catch, regular screenings, all of that. And then also avoiding, air pollutants. If you're, in an environment that, is, got a lot of pollutants, some people live in those type of environments or near something. And so avoiding exposure to that as well. So those are the main things that you can do to help promote, having healthy lungs.
Okay, so when we do talk about pulmonary rehab and the things you do to help their patients recover some of that usage of their lungs or capacity in their lungs, I'm not sure what the exact terminology is, lung function. So especially as it relates to lung cancer, how do you play a role in someone's recovery from that?
So basically what pulmonary rehab, our goal is to help to improve that lung function, decreasing severity of symptoms, and improving patients' quality of life. And so the role that pulmonary rehab plays in that is a patient will come to us if they've had lung cancer, surgery or treatment or something like that. They can come post-treatment to help increase their strength and endurance and stuff. And it's monitored exercise. It's a multidisciplinary approach in a sense that we have nurses, respiratory therapists, exercise specialists there, equipment, and it's done in a group setting.
Okay.
We also do education. And this helps to, increase that awareness of your lungs and what you should be doing to maintain that healthy lifestyle. So.
Because I'm sure after you have a diagnosis like lung cancer, or perhaps even a pneumonia, or maybe even COVID. I mean, I had a relative who had COVID, and they had a lung issues for quite some time. Your life is different, and you have a big awareness now of what your lungs did before, and now what they can do now.
Yes.
So
what helps with what we do is so activities of daily living are something that some of us take for granted because we do it every day. People who have lung disease or have gone through, cancer treatment, they suffer with shortness of breath that can be so debilitating that putting on your shoes is very difficult. Taking a shower. Different things that you take for granted that people have to sit down. So we try to help them with tips on how to go through just regular activities in a day, and that is something with the education portion, and with the exercise they get stronger, so therefore it's not as taxing on them.
So this, what you do, you're kind of touching on it, how it impacts the patient and their life. So your goal, like you said, is to see improvement. How much improvement do you see generally? Or I'm sure it's on a case-by-case basis, but what can someone expect?
Sometimes we measure things. We do pre and post like measurements. So we do sometimes see very little change. Sometimes if somebody maintains there and it's not progressively getting worse, that's a plus for them. You know, I guess people have different goals, and we try to meet patient individual goals and then, you know, our goals as well. A lot of times we'll have patients come in, they might be on 5-6 liters of oxygen, and then we can at least maybe get them down to 2. So, you know, decreasing that is a goal. Sometimes they want to be completely off of it,
Right.
and it might not be, you know, possible, but to decrease the amount is, you know, it is a plus. It is a positive thing. Sometimes people improve their lung function by 20-30%. It just depends on the lung disease, what's been going on, and what's happening. So,
And yeah, when we talk about that improvement, you talked about the day-to-day activities. I know that some people, we talked about a story of a lady that you guys helped, and she loved to travel.
yes,
Loved to travel.
Yes.
And then when her lungs were impacted by, I don't remember the disease that she had, but she went to y'all, and she is a testimony. She gave a testimony
Yes.
about how your rehab helped her to regain that portion of her life
yes,
back.
yes. And that's that. So that emotional and mental aspect also, because you're connecting with people who have similar problems.
Right.
Not everybody has trouble putting on their clothes in the morning and taking a shower. But if somebody who has emphysema or has gone through cancer treatment, they're suffering from that, and you've got them and you're on the bike next to them and you're talking and you get, you know, but you get to be around people who have similar issues. But you also have the team that we have that have been doing this for a while, and the support that you have from them is also, you know, it's an immeasurable amount, I guess. I
Yes.
can't put, you know, it's kind of,
It sounds like relationships
Yes,
form.
yes, there are,
And,
yes.
you know, in addition to their own family support or whoever they have supporting, they have that extra layer of support from
Yes,
y'all.
yes.
And they can depend on you for that. So that's
definitely,
good.
definitely.
So if someone needed your services, I would imagine that it starts with their primary care, who would refer them out to rehab services.
Yes.
But how would they ask for you or
They-
request you or get to you?
They can, I mean, they could call, you know, or obviously if the physician puts the order in, we'll reach out to them. But I mean, you want me to give the number? Or
Sure.
it's 985-898-3780 is our main number. And if anybody has questions, they can call, and they'll, you know, one of the staff will, you know, be able to answer any of the questions that they have specifically. So.
All right. Well, is there anything else that you want to add about this conversation, the topic of pulmonary rehab, education, resources, anything like that?
I think one of the things that we pride ourselves in is our team approach to taking care of the patients, and we treat you like you are, you know, one of our family. That's how the staff at the, you know, cardiac and pulmonary rehab, but in the pulmonary rehab too, you know, it's just an approach that we all are very much a big team, and we take it very personally in how we take care of the patients. So I think that that's a big part
That's what makes that connection
and we
happen.
enjoy, and, you know, we enjoy what we do. So
Good. Well, thank you so much, Missy, for being here. We appreciate it.
thank you.
And thank you for watching. Stay tuned because we have another segment coming up. We are going to welcome Caitlin Hunter. She is our Healthier North Shore Ambassador for our 2023 St. Tammany United in Pearls Awareness Month. So we'll be right back.